We are live. Welcome everybody to another episode of Blk Hlth. Let's talk about it. We seem to talk about everything else in our community. We talk about politics. We talk about sports. We talk about dating. We talk about just about everything except for Blk Hlth. So we've been on for about 7 months, and our focus is definitely Blk Hlth, all aspects. We've talked about talked about health in a number of capacities, but we haven't talked about it in terms of career paths and occupation. So my name is D.Moss, and at this point, I'm going to turn it over to my co-host, Justin Yard.
Hello, everyone. How you doing? We back again, and we're excited about this episode because we need to really talk about how we can now affect change in our community when it comes to the healthcare industry, because it is something that we don't get to see a lot of when it comes to our people at the front lines. And so we want to see different areas in the industry of healthcare that we need to be represented and kind of know that there are other career opportunities in the healthcare field. So I'm going to start off with Shaylease. All right. All right. So Shaylease, give me like kind of a snapshot of what you do.
Okay. So I work in the biotech industry in San Francisco for an oncology company. So we create oncology drugs, and I specifically do regulatory affairs. So the gist of it is that we represent the company in liaising with the FDA or any other health authority in the world in order to get our drug on the market or get market approval. And so in doing that, we're basically the last stop for the company. So we work cross-functionally, and we're responsible for all interactions, submissions, anything that has to deal with interactions with the health authority.
Okay, perfect. So hello?
Yes.
Hear me? Okay. So thank you. So you're in the pharmaceutical industry, which is broader right under the healthcare industry. So thank you. So Shaylina, sorry, if you can give us kind of an intro of who you are and then what you do as well.
I'm Shalina. So can you hear me, Justin?
Yes, we can hear you.
Okay. So I am a psychiatric mental health nurse practitioner. So I currently work in the mental health field, and I prescribe medications, psychiatric medications. I can also do therapy, but my main focus is the medication prescriber. I was a nurse for 10 years before I became a psychiatric nurse practitioner. So I also have a master's in nursing education, and then I have a postmaster certificate as a psychiatric nurse practitioner.
Oh, wow. All right. Let's get into it. Go ahead, Jess.
Is Joe here?
No, he's not. He left.
Okay, all right. So one of the questions I want to pose to you guys is, first of all, do you see yourselves or us as a people represented in your industry? Go ahead. I'm sorry. Go ahead.
Before we do that, is it okay if I ask both of them, starting with Shaylease? Tell me why you picked the profession that you selected. I know, typically our first 2-3 years of college, we have no idea what we want to do. We explore all different types of classes. We shadow in different career industries to see what we're interested in and what we're not. How'd you end up in your field? Why that specific field? Given that you have a PhD, you can do almost anything you want. You can pretty much pick your path. Why that field? Why do you feel it was important?
So actually, when I was in high school, I already knew that I wanted to major in chemistry. And so I ended up going to Norfolk State and majoring in chemistry on an academic scholarship that was specifically geared towards STEM fields. And then once I left there, I took a year off, and then I went to graduate school at UC Davis, where I got my PhD in chemistry with a designated emphasis in biotechnology. And so generally when you're in school, especially when you're getting a doctorate degree, they kind of gear you towards academia, right? So being a professor or maybe working in a government lab or something like that. And I kind of knew while I was matriculating, I knew that I didn't want to work in the lab anymore. And so the secondary certification program that I was in, which is how I got my designated emphasis, part of that was doing a 3 to 6 month internship. And they already had connections within the biotech industry in the Bay Area since we were so close. Um, and so I had plenty of conversations with the director of that program. And she kind of knew that I wanted to get more onto the business side and be outside of the lab and kind of have more of a cross functional um, interaction and
Okay.
exposure. And so I ended up getting an internship at a biotech company, which was about a year and a half. And then I rolled into a contract position and then into a full time position later on. Um, what drew me towards regulatory affairs is that, well, like I said before, I wanted to get out of the lab,
Yep.
but I like the aspect where we worked cross functionally. So you got a little bit of like clinical operations, clinical development. You work with the lawyer, so you do like the intellectual side. So regulatory, we do a lot of strategic planning and strategy, working with these different groups for a company in order to kind of pull the overall story of the drug together in order to get it approved. And so it was kind of like my first experience in industry, and I really enjoyed it, so I just stayed there. But I
Okay.
would say my first experience, I was able to get a pretty wide breadth of knowledge. So I started in kind of like the program management, project management aspect, which is what I mostly focus on now. But I also rotated into the commercial side of it. So where you work with the FDA in order to like approve any type of advertising or promotion. So what goes out and making sure that you're appropriately representing the drug. So say like a drug that has a lot of side effects and somebody in the commercials too happy, it's like that can be you can be fined for that because it's giving you like a perception of quality of life that's much better than what it really would be based off of what the side effects are. So you
Got you.
get exposed to like different aspects of it. And so I like the fact that even though you know what the rules are and you're learning the guidelines, which tend to change often, it's like you're always learning and every day is different. And each drug product that you work on or each company that you work with, even if the pathway is similar, as far as like getting something approved, the experience and the story of that drug is completely different. So
Wow.
yeah.
Okay. That was interesting. I'm glad I asked. Um, Shalina, if you don't mind, if you can just do the same, why that particular field? You went from being a nurse to a nurse practitioner. Why that
This
field?
kind of sounds okay. Maybe it's better now. Okay.
Okay.
It was just a little muffled.
Hmm.
So you want me to explain why I chose to become a nurse practitioner?
Yes.
Okay. So like I've always wanted to be a nurse. And I went to nursing school. I love to teach is one of the main reasons why I got my master's in nursing education. And I always knew I was going to go back for a nurse practitioner, but I thought I was going to do medical. And then I was working at Providence Hospital, recently closed, a psychiatric inpatient hospital that serves all populations, all geriatric kids, adults, and also a substance abuse unit. So I worked there for 3 years as a supervisor, and then my last job was clinical admission supervisor, which basically booking the whole hospital and doing detox intakes. So during my time there, one of my friends, we were talking, and she suggested me doing the mental health nurse practitioner, and there's such an under psychiatric mental health is so underserved. So it's so much needed for these patients. And I feel like it should be treated the same way as your regular health, your physical health, because patients are dying from mental health as well as your physical health. So I wanted to go back to help out to treat the patients because there's not enough providers. There's so many patients who relapse in their mental health care because there's no one out there to see him. There's a long wait list. Even now with everything with COVID, there's so much of a wait list for therapy, for medication prescribers. So that's the main reason why I chose to go back and to be helpful for the community.
Okay. Thank you very much. All right, Gus. Oh, we have Manny Perella. Manny, we're talking with Shalise and Oh, Shalina, about their career path and why they
Yes.
chose specific careers. If you can tell us a little bit about what you do and why you chose the career path that you're on, for our audience, it'd be so appreciated.
Yes. Yes. So I started so I was raised in Springfield. Several years ago, for the past like 4 or 5 years, I was an EMT in Springfield, working for AMR. And I started, I want to say, I did my undergraduate at UMass Amherst, and I got it in microbiology. So the science kind of always like fascinated me, but I knew at one point that I would have to choose between being either MD or PA. And I think because growing up, you didn't really hear much about physician assistant or nurse practitioner. That wasn't a field that was well known at that time. So it was in my senior year of college that I knew, that I even found out about a little more about the physician assistant program. So I applied one night, and I only applied to like one school. I went to Bay Path University. Thank God I got in. And I knew at that time, since I had already worked in Springfield as an EMT, I knew that I wanted to serve, Springfield as it was, seeing as I was raised there too.
Right.
So I went to PA school at Bay Path, and I requested to do all my clinical rotations in nearby cities like Springfield, Holyoke, and just underserved communities. And they worked with me. They tried to make it work. I think I maybe had 3 rotations that were not like fit in Springfield and Holyoke. So it kind of really gave me a grasp of the patient population
Okay.
that I was going to be dealing with. And then before I had graduated, I think about halfway through my clinicals, I was offered a job at 140 High Street. So I went into primary care for my first job as a physician assistant, with the hopes that of staying there. I don't plan on going anywhere else, but I definitely knew that I wanted to kind of give to my community, seeing as I was raised in it, and I experienced people, and as an EMT, you see people in like kind of their worst. But I saw how important, that primary care role was, and how important it was that if they had just gone for their physical, or if they have gone for their routine kind of checkup, they would have avoided being in the back of my ambulance. Because not all the times would it be an emergency. Most of the time it would be just because, they've had this chronic pain, and they just didn't have a PCP. So I think that was kind of what led me into, the primary care setting.
Mm-hmm.
And that was it.
Okay. And what's your
Here I
title
am.
again? And what's your
I'm
title?
I'm a physician assistant.
Okay, that's what's up. Thank you.
Thank you.
All right, Justin, I'm gonna turn it back over to you, man.
Yeah, Emmanuel, I would like you to briefly explain what that is, because a lot of people don't know. I feel like that's new, but if you can explain what a physician's assistant is briefly, that would be great.
Yes. So a physician assistant is what we call an advanced practitioner. Back then, they used to call it a mid-level provider, but we try to stay away from being called mid-level providers, because we do the exact same thing of what an MD or a DO, or basically what your doctor does, a physician assistant can do too. Same thing as a nurse practitioner. We can manage conditions, we can prescribe, we we pretty much do everything. We order labs, we interpret X-rays, everything that you could think of, that an MD does, we can too. The only thing, and this is kind of like a little fun fact that physician assistants can't do, is, I believe, give chemo, therapeutic drugs. That's the only thing that thank you. That's the only thing that I do believe PAs can't do. Yeah.
You're muted, D.
I said thank you. That's interesting because I didn't know. And so I'm the guy on the show who knows absolutely nothing. So I'm gonna have a million questions for everybody, because I know there are a whole lot of folks in our communities who feel just like I do. We're just like, I don't know what you're talking about. So
Yeah.
thank you.
Of course.
All right, Justin.
Yeah. So where do you seeing like all this, right? And you guys already hit on some of the topics that we're definitely going to talk about. Seeing that you guys are frontline, some of you guys are frontline Shaylease is like at that end of, all right, we're trying to get you to start taking your medication and things like that and getting those meds into the market. What do you guys see as kind of disparities within what you guys do? But I mean, like between people in underserved communities, like Springfield themselves. Like, where come some of those disparities that you see, or things that you see? I'll call inequalities, but I really don't want to use that word. But I would say disparities for now. But those inequalities that you may experience at your job.
I can tell you that for as far as mental health, there's not a lot of African Americans, and its research shows that reach out for mental health.
Mm-hmm.
And it's very sad because I think it's because the way they were brought up, raised, and especially for a lot of males to be strong, to be tough, and to hold a lot inside because you have to be there for your family. But they have a lot of stuff that's going on inside with them, and to talk to someone, a therapist, or meeting with a therapist to start. You don't even have to go on meds, just to start out with a therapist. But for them to reach out, it's a problem. And I think that for the African American community, it's mental health should be pushed, because there's a lot. I feel like even the young teen boys or the African Americans, there's a lot of violence and things going on, and these kids were probably raised in homes with a lot of trauma that they were exposed to, and they don't know how to handle it besides go to violence.
Right. And just being able to allow people a back door out of situations, be able to talk things through. Because, as a black male, I'm a grown ass man, excuse my language. And when I'm dealing with issues, who do I go to? There really isn't. I can't go to my boys. I can't go to the bar, go to the barbershop. I get wrong information. So you're absolutely correct. So by the time, after the situation escalates, by the time I'm, in a position to do something about it, I'm already in your care. So we got to talk about that. There's been a couple of shows where we brought people on to talk about mental health and why it's so critical to talk about. So thank you. Glad you said that. Justin, I keep jumping in, man, but go for it.
Yeah, definitely. I want Manny to kind of expand on his experience as a PA for sure, and some disparities he's seen.
Okay.
So the disparities that I've seen in primary care, kind of like what Shalina just said, and I was agreeing 1000%, is a lot of times I get, kids that are coming in either as, from their pediatrician and transitioning to the adult medicine, who are like 19, 20 years old, or even, in their 30s. And they're just telling me how angry they are, and they just don't have nobody to talk to because they, for whatever reason. I can think of one example off the top of my head right now of a kid I just saw just the other days. He was saying how he just didn't have nobody to talk to, and every time that he would talk to his boys, they would clown him for saying that he was being a female or being whatever showing any emotion was like a sign of weakness. And that visit in particular went on for about like 40-50 minutes, where I was telling him that it's not weakness, it's being human. It's normal to feel the way you're feeling. And it's just kind of like talk him through. And I told him, I was like, I'm not a therapist, I'm not licensed or whatever, but I can hear you out. And I just sat there and I just listened to him. And most of the patients that I see that are having issues like that is just, they just need somebody to listen to them. And on the other end of the spectrum, it just disparities in general. They just don't trust us. They don't trust medical providers. I had one patient tell me, she's like, I don't trust y'all. How do I I don't know you? Or for the most part, she's saying like, how can I relate to someone that doesn't look like me? And I was like, I hear you. That's why I went into this field, because
Right.
I understand what you mean. And she was like, I'm not going to take a medication because she's not explaining it to me, or they didn't explain it to me. So some of the times you just have to sit there and explain to the patient, like, look, you're on this medication for this reason, or what we're trying to do is this because of X, Y, and Z, and just taking the time to talk to them. A lot of times I think providers get in a habit of just kind of going, and they forget about the human side of just talking to patients and just
Absolutely.
explaining to them what this medication, why are you on this medication? And that's one of the disparities I've seen, is that they don't trust us. And I mean, can I blame them? I mean, let's be real. So I just try to bridge that disconnect, and I just let them know, like, look, it's not, I actually care about you. I'm not just here to, you're not just another patient. So
Yeah, cause I get that feeling when I go to very when I go to a doctor, I'm just kind of curious about, yo, are they steering me in the right direction? Are they prejudging me because I'm black? See, if I went and I ran into somebody like you, I'd be good. I'd be like, all right, just tell me what's going on.
Right.
Man,
For real,
it's a whole
for
lot
real.
easier than talking to somebody who doesn't have the cultural competency
Right.
to actually be able to, communicate to you effectively. So it really matters, man. I'm glad you said that, but yeah.
No, of
And then
course.
on the sidelines, JJ Ryan says, thank you for the work you do as well, Shalana. I've worked in a continuum of care in addressing mental health stigma. Mental health stigma seemed to be one of the biggest challenges to getting people the help they need, but that was in a predominantly Hispanic community. How do you think we can uniquely address that in the Black community? You're on mute.
I think it's more education, like more education needs to be provided, like more groups, even if there was like somebody in a role to start to initiate like a group therapy, like brothers or,
Yeah.
some for adults to go to somewhere to start where people can share. But I just feel like with the Black community, there's so many people, it's in others, but it's so much where people are just judgmental. And like I said, they're stuck on that mentality of being strong, this strong person that they have to. So it's like generation wise. Now, as you start to bring your child up, let them know that it's okay to go talk to somebody. It's okay to be in therapy. You're not crazy. Like I have people that tells me, oh, I don't want to tell you what meds I want to take. Or I don't want to, because you're going to think I'm crazy. And it's no, I want you to be honest with me. You're going to get the best treatment by being honest. People don't realize holding things in, you're not good holding stuff in, because eventually one day you're going to explode. So I think it starts with educating as adults are raising and bringing their kids up, normalize it, that it's okay to go see somebody. It's okay to talk to someone. No, and I'm not pushing medications. I'm not a prescriber who pushes meds. I'm big on therapy, as medication is just a small piece of treatment, especially if you're exposed to a lot of trauma. A medication is never going to take away that trauma. You have to work through and process that. So just normalizing it and not letting it know to be okay to go and talk to someone, I think is where where it should start. It needs to start in the home with parents, and not, having their kids grow up to where they have to be strong.
Okay. Manny, you want to take a stab at that? I know you just addressed it, but how many Black men come in and just kind of open up to you? I mean, just based on the vernacular, I'd probably sit there and kick it with you and be like, all right, man, so what's going on with this headache now that I'm done with all that?
Right. No, and a lot actually. And so I mean, I want to say maybe since I started in September, I would say maybe a handful of maybe 10, 15, and they really do just want somebody to just, talk to them and listen to them. And I think I open up whenever I start talking about mental health, I think one of the first lines I say is, I'm not here to push meds. I want to let you know that ahead of time. My job is not here to prescribe. That's not what it is. I'm here to help you deal with whatever it is that you're going through. And I'll never forget this sentence that a psychiatrist once told me. She told me, she said, your mind can be able to forget something. You can repress something for X amount of time, but your body will never forget it. And that really stuck with me, because it was like, she said, every cell in your body remembers every single traumatic event that you've had. And it's going to surface, whether it's now or later or 10 years, whenever it is. And it's kind of like a bottle under pressure. It's going to crack at some point. And, my job is to help that not happen. And if it's going to blow out, I guess, it's going to do it in a positive way, or you find some way to kind of be able to deal with it.
Right.
And that's what I try to tell my patients whenever I see, somebody of color just comes in and just talks to me, and I just let them know, like, look, this is like my role is a provider, sure, as a medical professional, but at the end of the day, I'm here to hear you out. If you have any questions, if you have any doubts, if you just need somebody to just kick it, that's cool. As long as I'm able to do my job and we get this out the way, I'm here. I'm all ears. Feel free. And I'll give you my input as a provider. And I'm very open. I'm very laid back in the office. And I think that because of that, patients respect it, and it's a different vibe that you get. You don't just get like, I'm here to see a doctor. I'm here to see my doctor. It's more of like, all right, I'm going to go see Manny Perilla. Yeah. He's going to help me out. I'm going to talk to him about this and that. And I think that's that bridging that I just feel like more providers need to be like that. So
right, but I think that's why, as Just says, I want to bring people on to talk about their careers. I think that's one of the reasons why that's so important. It's different when you have people who come from neighborhoods like yours. They come from families like yours. You tend to identify a whole lot more, which makes it easier for me to get the medical treatment, that I need. And, I hear the stuff about, the medications and everything. Shaylease, I'm going to put you on the spot. When people talk about medications, we know it's not all about that, but it's different when we can bring someone like you on just to give us a different perspective of all the different types of vaccines or medications and all that stuff that's out there, because that's your life and it's what you do. It's hard to go to someone, a non-person of color, ask about medications, and then people are condescending when they talk to you. Some of the questions we asked the last time you were on, you just answered it like you were somebody's cousin. Sit back, you answered the question, it was cool. But I have conversations with, white Americans and similar conversations, and it's like a condescending type of tone, like, well, you should know this. And we do ... and this particular chemical. And it's like, I'm not here for that. So talk to me. How do you, when people ask you based on your field, I know you're probably the family expert when people wants to know about different meds, although I don't know. How do you drill that home? How do we educate our community?
I mean, I think we had mentioned it when we had last talked a little bit, but
Yeah.
a lot of information is online, and I think one of the main issues is that people just don't know where to find it or know where
Right.
to look. Like Justin mentioned when we were talking before, and I know he's had previous conversations about like vaccines and things like that, but just going to the FDA website, right? It provides any and everything. Like anything that's submitted is public knowledge, public information. When drugs are approved, you can see all the documents about clinical trials, the different races that were in clinical trials. The sometimes depending on if there was like an advisory committee meeting or things like that, you can hear like the actual feedback from FDA reviewers, like they document all of that stuff. And it's all there. And I think sometimes people just have a hard time finding it. I know the FDA in general are like working on an initiative that is trying to reach out more to like people of color in the community and trying to
Right.
find ways to connect so that people have a better idea and understanding of like what they
Right.
do and the types of drugs that come through and how they work and things like that.
But in
I,
terms of career path,
mhm.
why is it important to have someone like you in your position, and why do we need more people like yourselves in positions like that?
Well, I think it's good to have people of color, just the diversity in general, like Manny and Shalina said, like it helps to see people who look like you, right?
Yep.
So for instance, like in my specific field, like where I work, I'm very much like one of a small handful of people at any given company at any given time. But like my network of friends who are like doctors, whether they're PhDs or MDs or NPs or physician's assistants, come from when I was in undergrad because we all kind of like aspired. And so, having that background. And so you want to bring other people in because the more people that you help kind of encourage to enter the STEM field, you get them more out into the community in all of these different spaces so that they can all kind of give back and explain things in a way that doesn't come off condescending, right? Because we all kind of have similar backgrounds for whatever reason, whether, you've gone through trying times or how you were brought up. And so, when you work from a space of love and just encouragement and educating people, then there's no reason to feel like what you're saying to people, you know what I mean, to talk down to anybody. But I think, being on both sides, right? Because I know when I look for primary care providers or any type of doctor, I specifically look for Black doctors, whether they're male or female, just because I feel like there are things that they can relate to or certain nuances in dealing with people of color that sometimes the majority doesn't understand, right? And I think even just with like some of the drugs and things that are out there, right? When they do clinical trials and there tend to not be a lot of Black people in those clinical trials, right? And it's because there's a certain level of trust that isn't there and being tested and things like that. So then you also have that other aspect where if you are reading stuff and it doesn't really have a high number of Black people who participated, then it's like, does this drug really work for me? Or is it going to have other effects that aren't really accounted for because there aren't any people in it that look like me? Or who have, you know what I mean, potential like same health histories that I would have. And so when you see people and you have people in all these different spaces, and you're trying to help bring up the people behind you to get into those spaces, the more you see yourself, then the easier it is to kind of trust and for people to open up, right?
Right. Okay. Manny, why is it important when we talk about brothers? Why is it important for us to see you in a position that you're in?
The way I like to think about it is why it's important to see me. I think it's just showing an example that that you can do it. I know it sounds kind of cliche or whatever,
It sounds
but
real.
it's like you can do it. It's not something that's out of reach. It's I was raised in Springfield, and like I tell people all the time, like, sure, Springfield is known for some of the negative stuff or whatever, but there's some positive stuff that comes from us. And I think having somebody see me and even when I was on my clinical rotations and I was doing for example, like pediatrics, you would see parents kind of tell their kids who are like 17, like, you see, if you get your act right, you could be like him right there. And although I understood like the message of what they were trying to do, I didn't want them to kind of like resent me, like, yeah, but he doesn't understand where I'm coming. You don't know what I'm
Right.
going through. And I think that when somebody sees me in office, I kind of without getting into obviously like personal stuff, but let them know,
Right.
like, I know what you're going through. I know what you mean by it's not possible to get all the healthy stuff or whatever. Like, I try to be real with the situation. Is like, I understand what you're going through. Just try your best. Let's do little by little instead of being very formulaic and like very algorithmic with them as to what needs to happen. Is understanding that they can't do 6 times a week for 45 minutes of physical exercise because they got XY different things that they got to worry about, or the light just got shut off. So I don't think that they're really worried about getting their A1C down right now. I think they're more worried about keeping the light on in their house. So that's what I try to bring to with, and kind of let them know, like, I understand. Look, but just try to do little by little. Whatever you can do, I'll take it. I'll take it and whatever, and I just work with them and try to do it as best as I can.
Okay.
That's so true. You know what I mean? I feel like we live in survival mode. So then health is second to that. And because of that, when we go into the doctor, the first is a mistrust. The second is you don't understand. Even when I know I know Manny. And so I know Manny is like me somewhat, but he don't understand because I got this problem over here and this problem over here. So I can't even worry about going to the grocery store and getting fresh greens and things like that. And I think for Shaylina, and peas are moving up. You know what I mean? And I think it's important that women, men get to know exactly how strong you guys are right now. Like what you can do now. I think they just passed a law, but kind of explain how closely related you are as far as the doctor and the MP and how you can foster some real change.
Okay.
I mean, it's right now we have to have supervision from our physician, but once you've been practicing for 2 years, you no longer need that. So I can open up my own practice or practice on my own.
Wow.
Yeah.
Wow.
And that just got approved too, right? Like, it's a law, like not like last week, I believe they now can work independently without the help of without the like working under a doctor anymore.
Right.
Oh, wow.
Yeah. We still got to catch up as physician assistants. We're always lagging. We're like, maybe 10 years away from it, but we'll eventually, we'll get there.
Okay. So let me ask you guys, how do we normalize conversations around health in communities of color, specifically in the Black and Latino community? How do we normalize this conversation and make this a part of our everyday conversation? We talk about sports, how grandma, okay, how's your health? How do we normalize these conversations? Anyone?
Well, I can start. I don't know. I feel like the only way or the easiest way to normalize things is for people to kind of just be more open, right? I think a lot of people go through the same struggles, regardless of whether it's mental health or personal health or anything like that. And when people are more transparent about it or more honest about what they're going through, they'll see that a lot of other people are going through the same thing. And so then that fear of judgment from it, I think, will kind of dissipate a little bit. I also think in general, and just having conversations, just kind of going into it in speaking, going into it with no fear, but on the receiving end, being non-judgmental, right? Like just allowing people to speak and not really passing any judgment on how they feel or what they're saying to you. I know within my family and within my friend circles and the communities that I, go in and out of, like we're all very open about what's going on. And in doing that, we all learn, right? Because everybody's experience is slightly different and there may be different perspectives of looking at things that will help you in whatever situation that you're in. And so for me, that's kind of what's always worked.
Okay.
But yeah.
All
I
right.
think a big thing too is listening, like listening before speaking. So a lot of times people go to someone and like Shaylee said, and am I saying it right, Shaylee? And they're just so quick to speak or they're so quick to judge. So it's just like, just sit there and listen. Let someone talk. They may just go into you just for you to listen. Like, I think sometimes just listening to someone and letting someone talk or vent is very important.
Okay.
Yeah, and I think the how to bring awareness, I think with what we're doing here, I think we're having these discussions like this and letting people know that it exists. Like you're not the like what Yah had said before. Y'all not the only ones that are going through it. People go through similar things all the time. And just kind of like through discussions like this and having more people engaged and just allowing yourself to be asked questions and answer them to the best of your ability. And I like I say all the time, if I don't know the answer to it, I'm not gonna BS you and let you know. I'm gonna let you know. Look, I don't know the answer to that. I'm gonna figure it out. I'll ask somebody that does, and do that,
Right.
and just kind of spreading more of that that trust. How logistically, I don't know how, but I think through these we're definitely making progress.
Okay. And I just want to throw out, when I talk about with some of my white colleagues and we talk about healthcare and some of the issues and that we talk about regarding communities of color, they have the social capital where they can pick up the phone, they can call the family doctor, they can call someone in the family who does a number of things as it pertains to the medical industry.
Yeah.
We don't necessarily have that luxury. I call my aunt who will tell me, well, just drink some ginger ale and lay down. Oh, just drink a cup of ginger tea, you be all right. So it's kind of like I'm describing some of the things. So take mental health out the picture, but even when we talk about our physical health, we don't have that luxury. So as we have this show, we're talking about career paths. Really want people, especially young people, to really listen to what you guys are saying and be like, you know what? It's not necessarily about the money. I want to make some money, but there's a reason why I need to be in that particular field. Me, I chose politics. I think if you want to change the political process, you have to get inside and you have to kind of tinker with things and change it from the inside. Fight where you can, negotiate where you can. In the medical field, it's something I don't know anything about. A lot of people don't. I just think it's critical that people see the three of you and everybody else who's out there and just hear what you have to say, because we need more Mannies. If they had more Mannies, I'd probably go see my doctor on a regular basis. I'm just saying.
Yeah.
I just think that's really critical. Maureen Jones says, open opportunity to hear from awareness like this one in regards to normalizing that conversation. It's one of the things we need to have more often. As we talk about social ills and things that impact our community adversely, I just think these conversations are just as important as talking about the inauguration that took place earlier today. Because I think it doesn't matter who's president if my health is horrible. When we talk about pre-existing conditions, as we talk about the COVID virus, we deal with these conditions every day. We put a Band-Aid here, another Band-Aid there, but we don't seek the medical attention that we need. We know there's historical issues that we don't even have to bring up today. I think we all know what they are, but it's different. I walk in and I see a Shalina. First thing I'm going to do is go, oh, all right. And I'm hoping that she'll come over to deal with me rather than the other person. Or if I go to 140, if I go to High Street, I'm looking at Manny like, are you coming over here? It's just
Daryl, believe it or not, though,
yep.
I've been experienced by my own kind, and I've been asked when someone seen what are your credentials, and they want to know what are my if seeing me is like, well, what is she doing there?
Yeah.
By
And
my own kind.
Yeah, and it's so funny because I'm lucky enough to have and sometimes unlucky to have three doctors in my family, three nurses, whatever the case is. Sometimes unlucky for real.
You're lucky.
I'm lucky.
Yeah, you're lucky.
Yeah, I'm very blessed. I'm blessed to have those doctors there, and within their path, besides just being ostracized, marginalized through going to medical school, when they get and sit in that desk, they realize, whoa, people really don't think I should be here. And that's another experience I don't think a lot of you guys should talk about too a little bit. Like, and tell them, like, listen, we can do this, we'll do this, continue to do this, and how that's important to them to understand, like, we're here and we're professionals and we know what we're talking about.
Okay.
Yes, that's true. That's actually true that Justin says that. Even to this day, I still get questioned. How old are you? Like, are you even able to like treat me? Because I'm dealing with adults. I'm not dealing with, from 18 and up. And a lot of them, actually, most of them are older than me. So they a lot of times they'd be like, like, what do you know about any of that? And I've gotten questions with exactly like, do you know what you're doing? And along with that is not a lot of people know what a physician assistant is. So a lot of times they're like, even in the name, think of the name physician assistant, we're looked at as like, we don't know as much as a doctor. We can't do as much as a doctor. So I'm constantly hearing, oh, you don't know what you're talking about. You're just the assistant. You'll get that a lot. And you just have to learn to brush it off and just be like, okay, no, I went to school for X amount of years. I know what I'm doing. I can go and consult if you'd like, but I can guarantee you 99% of the time they're going to agree with what I'm saying. But there is a sense of like, I have to show, if I show any weakness or any kind of like, I don't know what I'm talking about, the patients are the first ones to know, are you sure this man knows what he's doing? I don't know. And if they get the slightest sense of that, they won't take the medication or they won't really take my advice. Mm-hmm. So you almost got to put up like a kind of prove to them that you know what you're doing and that you deserve to be in the position that you're in. And that's on a day-to-day basis.
Right. And the flip side is we're so conditioned to believe that our folks cannot work in these fields. Or if so, they're coming to, take away the pee bucket or sweep the floor or something. And I believe that we are severely conditioned to question the value of our own folks. And that's one of the reasons why, we started the show. It's like, we got to break that. That's just absolutely crazy. So, Shalina, I'm just curious, when that happens, how do you respond to situations like that?
I just answer them. I just, tell them that I'm a nurse practitioner. I do the same thing as a psychiatrist. They just, as a doctor, they went to school longer than I am, but we both do the same thing. I can prescribe meds, educate, I could do therapy. Psychiatrists do not provide therapy. And I tell them, actually, most patients do prefer a nurse practitioner. And I think it's more because of the nurse in them. We provide more time, provide more education. Whereas most physicians, nothing against physicians, but they just have they don't take a lot of time, is more with their patient as nurse practitioners would.
Yeah.
And
even the approach.
I just explain that to them when I laugh in the back of my head because I can't, it's like someone of my own like kind to be, instead of like being like, okay, I'm seeing, but and then I do have those that are like, oh, what? Like, they're like, oh, like, do you think, oh no, you're a nurse practitioner? Like, yeah, like, it's good to see someone of their own kind that's in the field. But then when you get questioned from your own, it's kind of like, okay,
Yeah.
I was going to say, I think it was mentioned earlier, but a little bit of that comes from people just not having like a thorough understanding, because like my mom's a nurse practitioner as well. And in general, I think they've always, nurse practitioners and PAs, there's a little bit of like undervaluing because people don't really understand what you all do. And in speaking about the difference, like Shalina mentioned, I know that what made my mom want to be a nurse practitioner over being an MD was the fact that like you have more face time with the patients and you have more time to get to know them and interact with them. So you have a better understanding of their background in health versus it kind of just being symptoms written in a file and then the doctor popping in for 10 or 15 minutes to just kind of read through it and, render their assessment. So.
Yeah, and I get that all the time too, is that they prefer, the advanced practitioner, whether it's the NP or the PA, whoever it is, they prefer it because they say that you guys, you actually listen to me, The doctor is, I don't know if they're conditioned or whatever it is, training that they go through, that is kind of like a in and out type of deal. Like they're like, okay, this is what's the problem. All right, we're gonna do this, we're gonna do that. All right, any questions? And it's kind of like not as much FaceTime and just bedside manner, if you want to call it that. And even the approach, there's differences in like the approach to medicine and P to PA. I mean, we can go for days about that, but that's the main thing, is that discussion and that sitting down and listening to what is going on across all advanced practitioners is it's important.
But can I say this? I do think that primary care offices and not like no person, like I feel like there's more education needed for like doctors and primary care as far as when it comes to mental health, because I feel like they kind of like every kid, so many kids have ADHD. Like, do they really have that diagnosis? Or so many people are bipolar just because they have mood swings, like, and they do not have those diagnoses, and they're putting them all these medications that they may not need. So I don't know, like more, I just feel like more education needs to be spread like all around.
Yeah, it's crazy because Manny and me have a lot of conversations, and with him being from where he is, it really does help. You know what I mean? Because he understands the pathology of a person in their history because he's around those people that he's working with, as opposed to the counterparts where I'm telling you, the cultural barrier, and I call it culturally relevant care, is the most important thing ever. You can misdiagnose somebody more faster than you think, and we've seen it. And because I'm around doctors and nurses and stuff like that, we see it a lot. That understanding of cultural competent care is something that your clinical rotation can't teach you in 2 seconds. Going four at Mason Square, you can't go to Mason Square Bay State and think you're going to get that in 2 months of a rotation. You got to have that, and that's why it's important to have the Mannies and the Shalinas there, is because it's like, all right, he just saw something happen in his family. That happened to my cousin. This is how he got over it. Well, that happened to me. And this is how I go to, rather than saying, all right, take this 2 times a day. And that's something that's pivotal to understand for people watching right now.
Absolutely. You know what? I had an experience once. I'm going to share with y'all. I went to the hospital. When I went to the ER, I'm having chest pains. So I go in there. They spent the first 20 minutes when the doctor finally showed up, whoever he was, they spent more time asking me questions about, my nightlife and if I tried cocaine or if I did any drugs, if I drank. Well, I'm like, well, why are you asking me all this? I'm in a suit and tie. He's like, well, you fit the profile. The hell do you mean a profile? I said, so I'm in right now. I think I'm dying. And you're talking about cocaine and everything else. Literally said cocaine. And I'm like, give me somebody of color, somebody I can talk to who can say, okay, this dude may be going through something right now. They were more concerned with that. And by the time I actually convinced them that wasn't my lifestyle, he says, okay, I'll have somebody else come in and look at you.
Yeah,
I'm like,
I'm surprised
really?
they didn't say give Ativan.
They did to me. They tried to get me out of there. They tried to get me out of there. I'm lucky I knew something. I was like, don't touch me. Don't touch me with the Ativan. And I'm sorry to cut y'all off, but as soon as they try to give me Ativan, because I know about, you know what I mean? I'm with the right people in the medical field. I said, nope, give me a new nurse and give me a new doctor. I said that. And I was shivering like this. And I got the gumption to stop and be like, listen, get me another nurse, because of the knowledge which also needs to be given to the patient as well. The patients don't even know this. I want a new one. Need a new one. I had a Russian lady. She was like, we're gonna put you on Ativan. Your heart rate's too high. I was like, no, don't give me that.
And a lot of times the fault in that is in the ED is they think all right, let me go even deeper. So 90% of what they see as chest pain is people who have uncontrolled anxiety or whatever, or that they don't know that anxiety is kind of showing as chest pain, the chest discomfort, or whatever it is.
Yep.
So a lot of times what they're trying to do is they're trying to eliminate, if he gets better with Ativan, then boom, that had to be the issue. The issue had to have been anxiety. And it gets even deeper because it's like, if they had, established with therapists or psychiatrists, or maybe then obviously that kind of declutters the EDs with cases like that. So when somebody that does come in with actual issues that are not anxiety related, it forms that kind of that initial kind of like, well, what are you doing? Why are you giving me Ativan? This isn't anxiety related. Like I'm having chest pain, or I'm actually seizing, or whatever the case is. Like I'm actually having issues, and it creates that because they're on a constant go in the ED, especially Bay State, because I personally think they're huge, and they're constantly dealing with issues that could be treated in a primary care setting. So, and the way they always taught me when I was on my clinical rotations was our job is to stabilize, and then outpatient wise, they can kind of they can deal with it. And I think that sometimes things go under the rug, like actual issues. So I don't know where the solution lies in. Maybe education is, but I don't know.
Well, and I say that to say I left Springfield. I went down to Hartford Hospital. I got a sister. Totally different conversation, totally different reaction to what I was going through, told me exactly what it was happening, the whole nine, took the time to explain it. So I say it's really important to have folks like y'all in the industry that you're in, because you're more apt to not stereotype somebody and actually check to see what's going on with them. It's a whole lot different. You see a brother walk through with a certain tie, you don't assume that he's a cokehead. I'm just saying. So you take the time and you talk with them to find out what's going on. I'm like, I already got my issues socially with mainstream America, but don't walk in and judge me because now I'm worse. So I know now if I need ER care, I'm going up the high street. All right, Justin, I'm going to turn it back to you, man.
Yeah, I have another comment. You know what I mean? I want to get some questions in, but I got another comment. It's like they have to know that you're human. And because I know some of these people, right? It's human, right? They take their health serious, right? But you might catch them one of them eating something they're not supposed to be eating or doing something. They might take a break off of doing whatever they're doing.
Justin.
You hear me?
Yeah, I could.
You
Yes,
can?
you can't hear you. So you might have to
It's
slow
just
down.
staticky, but maybe that's just me.
Okay, I'm sorry. But knowing that you're human, you know what I mean, is so important. A lot of people have to know you guys have lives outside of here because, to be honest, they treat people in the medical field as like non-human robots as well. From the outside looking in, a lot of them are like, you don't understand because you don't have, or whatever the case is. And they have to know you're human to help them get through their head. Like, all right, the advice he's giving me or she's giving me is something that they've used. You know what I mean? And that's another portion of that people got to understand as well.
Justin, we have 7 minutes left, so we don't want to keep everybody up. We got 7 minutes, so let's if people can just get their thoughts on their careers. If I had a room full of young people in the room right now, all about to head off to college, what advice would you give them in terms of choosing a career similar to your own? So I'll start from the top with Shalina. And Shalina, am I saying your name right?
I'm sorry. What advice would I? Yes, Shalina.
Okay. So
And
what advice would you give if I had a room full of young people who are, either in college or on their way to college? What advice would you give them in terms of trying to encourage them to consider a career like your own?
I mean, I would tell them that to make sure it's something that they want to go into. My field, I mean, being a nurse is different. Like you can go into being a nurse. There's a lot of specialties. And as long as you're caring, compassionate, don't just do it for the money. You have to have it in you to be a nurse. But nurse practitioner, mental health is a specialty. And it is not an easy career to go into. You have to love what you do and know that it's going to be tough days. But do not give up and to be your own advocate.
Okay. All right. Thank you. Okay, Manny, same question.
So, what advice I would give to a room? So, what I always say is, because I'm a part of the BSET program at Bay State, so we do like mentor-mentee program, and I'm telling my mentee all the time is, don't give up, no matter how hard the road gets. But also, I try to be realistic with them and understand that it's going to take a lot of sacrifice. This isn't a job that if everybody could do it, we would see more. There comes a lot of sacrifice with being whether it's PA or MD or NP, a lot of sleepless nights when you're studying, a lot of time away from being with family. You know, your whole life for a moment when you're going through school is kind of put on pause so that you could be able to be that provider. And I think a lot of people, they think it's easy, that, you know, they see us doing it and they're like, oh, I want to do it. And that's great. And I love the enthusiasm, but understand that it doesn't just come, it comes at a price. And that price is the sacrifices, the sleepless nights, the not being able to do, you know, let's be real, the Friday night life that you're going to have to give up so that you can be able to study for that exam, or so that you can make sure that you're the best provider that you can be. It's going to take sacrifice, and there's a balance between all of that you got to like learn. And I would tell them it's worth it. And I would tell them, you know, on the road too, it might sometimes feel like, you know, you don't got enough, or you can't do it, or am I doing the right thing? And like Shalina just said, you got to know that this is what you want to do, and that you are compassionate. You know, you got to be compassionate with it. And if you're gonna do it for the money, go somewhere else, because I'm like up to here with that. So we got to be realistic about the situation. I'm just saying. So
keep it real. We good.
And yeah, and that's about it.
All right. Thank you, Manny. Shaylise?
I think with STEM fields or doing anything in the medical field or sciences, you know, it's not for the faint of heart, and you have to be able to push through. And so, of course, it has to be something that you really want, because you have to work very hard for it. Like, I've known plenty of people who've kind of thought it was an easier path to go through, and halfway through decided like it wasn't for them. But I think also, based off of my past experience, it helps to, like Shalina mentioned, like, you need to advocate for yourself, and you need to be and make sure that you persevere and are determined. You also need to make sure that you have a community around you, right? Whether it's support within your family or finding support within your friends or peers during your schooling or anything like that. I know for me, we all leaned on each other to get through it, because it was hard for everybody, regardless of what you're going through. And then one thing, one of the staff members when I was in grad school had mentioned, and he was just like, you know, sometimes people stress out so much about how long things take, and, you know, you worry about it. And in the grand scheme of things, it's like, okay, 4, 5, or 6 years of my life to do something is this much in your whole entire life. Like, I did grad school and it took 5 years, and while I was in it, it felt like it was forever. And then I woke up and I was already 3 years past it. You know what I mean? And so having the support with my family, and also having like the support with my friends, because we're all kind of going through it, and then just making sure that you're finding it in other avenues. So I definitely made sure that I was involved in like in different science communities that were geared towards people of color. Like, they had NOBSHA and they had NSBE, which are like national organizations for Black chemists and chemical engineers, or, you know, so like these, so that you meet other people from other areas and in other spaces that can help support you and push you through. And all of that has kind of helped me persevere and make it to the end. And then, you know, as I think Manny mentioned as well, just being able to reach back and use your experience to kind of give that same support and mentorship to other people is also something that's like just really awesome to do. And when you're able to see that you kind of have like that impact on other people as well, you know, and that, you know, for your siblings or people younger than you, that they have somebody to look to and be like, okay, I know somebody who does this. I see them in this space. I know that I can do that too.
Right.
So.
Okay. Thank you. Thank you, everybody. Justin?
It's amazing because all these people in here are what we would call young, or we would associate with being youthful. I think everybody's young, but it's you guys are.
Me too? You including me?
D, no, we can't do that. I mean, we ain't gonna bash you on the slide right now. All right, you come on, man. You own the club where Biggie was shot at. Stop playing. But it's amazing because you guys are young. You know what I mean? And for me, especially, me and Manny been talking for years, and I saw him literally through his process, and inspired me to tell other people, listen, become a PA, become an NP. Like I'm telling people, when I make Shaylise, it was crazy. I know I'm talking for a long time. We're about to be done. I'm sorry. When I met Shaylise, it was crazy. We went crazy. We was asking so many questions because there's not too many Black chemists and chemical engineers as well. And that's a field that is also healthcare. All right. It's healthcare, y'all. So it's just dope. And I'm proud of all you and keep doing what you're doing. Inspire people. And if you can get somewhere where you're in a mentee and mentor program, keep doing what you're doing.
All right. All right, everybody. This is Blk Hlth. Let's talk about it. If we don't do anything else, we need to talk about our health. There's nothing more important. You can have all the money in the world, but if your health is bad, the folks who inherit your wealth, they will definitely appreciate you. You have to take care of your health. You have to have conversations about health, physical health, mental health. If we don't take care of that, we're not taking care of business. So with that being said, we'll see you next Wednesday. Much love, much peace, much respect. Thank you to all of our guests. Thank you, Shalise, Shalina, Manny. Shalise, someone asked earlier if you're originally from Springfield.
Yes, I am originally from Springfield.
So yes,
Springfield
Miss Jones, that is Shalise Ross from Springfield. So with that being said, we are out of here until next week. Much love, everybody. We out. Thank you.